Hello, hi, this is Tion Woods. Welcome to part one of my four-part series of Growing Leadership. This first part, I'm going to review some articles you read in weeks 1 and week 2 of my innovation class. One of the articles I thoroughly enjoyed was the article of The Vulnerable Leader. This article talks about to be a great leader, you must show vulnerability. Too often, especially in my culture, people are asked to be real, to maintain a sense of identity, to stay true to yourself. And this article is saying that leaders that demonstrate empathy or are able to relate to audience are better suited to be leaders. For the majority of my adult life, I thought I was a natural leader. I thought I was a born leader. But reading so far, I realized that it's not entirely true. Leaders aren't born, they're made. And with this article, I think I seek to be this type of leader. I naturally empathize with my troops. I know that being a leader, you must not only lead but follow. It's very important. I mean, I'm not perfect. I think most leaders have some sort of imperfection. No one's perfect in this world. That's my opinion. So I often show that side that makes mistakes, and I own up to my mistakes. In the Air Force, in the military, we're told that it's okay to make mistakes. Just own up to them and move on. You learn not only from your success but your failures. And actually, from my failures, I learned more, I believe. So far, in this chapter, we looked at vertical and horizontal organizations, and my organization currently that I work for Riverside Community Hospital. It's a tall organizational structure. It's very interesting. We have a CEO and a director report to the CEO, and then the manager that report to the director, and then the underlings that report to the manager. And it's very integrated. It's a flat concept. We have daily meetings. The manager have daily meetings with the director. The director have weekly meetings with the CEO. So the chain of command is they have an open door policy, similar to what we have in the military. But you don't go straight to the top. You have to at first you have to go to your supervisor and try to handle things at the lowest level, as we call it, especially with the chain of command. Some other good points I looked at. Everything in society utilize vertical orientation, including organizations. Leaders gotta be both have a vertical way of thinking as well as a horizontal. But a vertical way of thinking is more about control, and horizontal thinking is more about relating to your audience or your followers. You got to be both, especially nowadays. You got to be able to relate to the followers, and I think that's more about when I read the article that looked at the vulnerability of the leaders. This article talked about empathizing or showing the CEO of a company actually stepping from behind a podium. The CEO would do a presentation, and how had the razzle dazzle, had slides all prepared, everything, and the CEO decided, I'm gonna just speak from the heart, and I believe that's the way I try to practice. I can, like anybody, I can put PowerPoint together and do a presentation, but I believe the best message is one where there's empathy, where the audience actually understands where you're coming from. Where the audience actually can sit there and they can see what you mean, This CEO, for example, hold back tears when they were describing how well the employees did. So she was very happy. And I think this is a great way to interact or to relate to your followers. Often, in my current environment, like I mentioned, I'm a captain in the Air Force. I have have enlisted members below me, and I've learned. I'm a bit of a Mustang. I started the military as an enlisted member, and I've advanced up the ranks, and I'm an officer. And I've seen great leaders, and I try to emulate those leaders, some of the skills they have as leaders. I believe some of the principles that we learn in these two chapters, the whole are made up of the parts. One of the big principles talked about. So in the military, we said we only as strong as our weakest link. So if you have a member of the team or the squad, as we call it, that's weak, you try to improve it. Maybe it could be in PT, which is physical therapy. I mean, the physical running. Maybe a member may not be as fast, but you weren't that member. You help bring them forward. You don't pull them down. So that's one of the things that we looked at. Other points that these last 2 weeks, other things that we review that I really enjoy. Looking at healthcare. Healthcare is local. The system within healthcare looked at point of service and it's outwards. If a healthcare provider is not providing direct care to a patient, he or she is serving someone else who is. So if you're not the one that's currently giving care to the patient, you're helping someone else that is. This was very important. Also adding value to a parts or adding value to the whole. So you must bring something to the organization. It's another important point to ponder. But like I look over the first 2 weeks, very interesting. I'm very excited to look over for the next 6 weeks. So far, I've thoroughly enjoyed everything. I've enjoyed this class. And yeah, this is part 1 of my 4-part series on leadership. Thank you for your time. Hi, this is Tion Woods again. This is part 2 of our 4-part series on leadership. Looking at the last 2 weeks. Some of the things we looked at week 3 and week 4. We looked at looking at cultures. Every organization has a culture. Even individuals have a culture. As you can see on our military uniform. Military, we have a culture, right? Service before self, honoring all we do, death before dishonor, right? The military culture is you want to be the best, right? In the United States, we pride ourselves, or United States Air Force, United States Army, Marine Corps, Navy. We pride ourselves on trying to be the best. So that's our goal. We try to be the best. We try to give the best. My civilian job, I work at Riverside Community Hospital. It's HCA hospital. Our goal is, our mission is to deliver prompt health care to the local community that is in need. We don't have any religious affiliation. My organizational culture is one of innovation. We have ideals in place where we reward innovation. Every year they have a contest, if you will, where ideals are submitted, and if it can save the organization money or time or improve the patient experience, you get a prize reward of $10,000. That's an example. Innovation. My project, my clinical scholarly project, I'm doing looking at African American males over the age of 65 with acute stroke and how to manage these patients, telemedicine versus traditional medicine, and tying all this together with the DNP process. Being a DNP, we all see a lot of members in my class already are nurse practitioners, already have masters. We learn how to answer questions. Now, I think the big thing is how to ask the question. That's been, different, that concept. We also looked at the essentials for DNP. Some of the things you should know. some of the things that they mention as scientific underpinning, advancing the nurse practice. I think those are very important concepts. With my project, I want to look at this particular population. I myself, African American, have a long family history of stroke and other medical ailments. So I want to address those areas. I have a vested interest as an individual. I guess my culture. I love technology. I love innovation. Just repeating a quote I read: "Perfection is the enemy of innovation." So I don't see myself as perfect. I very much embrace change as my, like I mentioned, as do my civilian employer and my military employer. I think embracing change is very important. You have to be ready to accept change. I read some studies. One study looked at a group organization that when they looked at change and the employees that were more willing to change or more accepting of change, let ideas flow freely, they were happy employees. They were more happy. Creativity were up, better profits. So that's very important. Change is guaranteed. I think Benjamin Franklin said, "Death and taxes are the only guarantee. Death, taxes, and change are the only guarantees in life." And I agree with that. I agree very much with that statement. Other points that we looked at, other articles looked at the 10 phases of innovation. I consider myself a hurdler. In the military, we were often trained. I know I go back to the military as I just got off reserve duty. We looked at adapt and overcome. During my career, I've been in the military, like I mentioned, for the last 21 years. Some active duty time, some reserve. There haven't always been perfect situations. I've been in hostile environments, and you adapt to that environment, your local surroundings, and you overcome. They also embrace the thing of change. With my clinical scholarly project, I am at HCA Hospital. We do not have IRB. We do have other stakeholders. So some of the big thing is to get stakeholders buy-in. So I discussed with the education department. I met with some of the neurologists. What my plan is, how I'm pursuing my DMP and how I'm pursuing this project. So I believe the most important thing was to get buy-in. So I met with them. I plan to meet with them again. I plan to let them know some of the things I want to do with my study and see if they have any additional input. So that's very important. I believe in innovation leadership. I believe in process improvement. I think having an innovation leadership is very important. It's a way of doing business, and it's essential, I believe, in this type of environment that we currently reside in. Some other key points we talked about. We looked at forming partnerships, thinking outside, not staying within your small group, but actually expanding your core group. Talked about involving stakeholders, advancing innovation, looking at multiple levels of collaboration. So with my project, I'm collaborating with neurologists, primary care doctors, also other advanced practice entities, whether it be clinical nurse specialists, nurse practitioners, or other types of physical therapists, different involvement. But so far, it's been good. We have the way done. We're done with week 3 and 4. I'm really learning a lot about leadership. Like I mentioned earlier, the more I learn, the more I realize I don't know about leadership. I foolishly thought I knew a lot about leadership because, I've been in a lot of leadership classes with the military. I went to commissioned officers training. I've been through reserve officer training, all these leadership courses, but I'm learning a lot in this course. Um, and it's not just limited to healthcare. I'm learning that leadership is it's not just using healthcare or in the military. It's using everyday life, and we all are leaders. It's very important to remember that. And to be a great leader, you must be a great follower. And being that leader, I think you should listen more than you talk. My grandmother always mentioned that God gave us 2 ears, 1 mouth, so we should speak less and listen more. Anyway, this is part 2. I'm enjoying this so far. I'm halfway through, and I guess I'll talk to you next time. Thank you. Hi, this is Tion Woods. Welcome. This is part 3 of our leadership series. We're looking at weeks 5 and 6, almost heading to the home stretch. In this week 5 and 6, some of the concepts we looked at. Some of the readings include Sharma, Theory of You, very interesting. Theory of You talked about different ways of listening. I think I'm more of an empathetic leader. I need to be a generational leader. I need to get to that point. I try to relate to what I'm hearing so I can be empathetic and actually hear instead of just being just downloading information or just passive listening. Other issues that talked about was recognizing blind spots. Recognizing blind spots is very interesting. The blind spots can be a potential pitfall during implementation. So when I'm implementing my project, I should try to be aware, identify the blind spots. Sharma described the blind spots as invisible dimensions in which our attention and inattention begins. In our project, all our projects, we want to look at the how, when, and why. But by doing that, we can still miss these potential blind spots. These potential blind spots can cause a different point of view. To avoid this, you got to make sure that you take in all accounts the past learning as well as the current best practice and future learning. And when I say future learning, I'm meaning what is actually happening right now, what's currently occurring. Sharma's solution to this problem was to look at future possibilities. If we explore all our possibilities, we can see what can occur. So it's very difficult to avoid conflict. Conflict is very common. I'm sure most of you in this class are probably in some kind of relationship, whether it's marriage or boyfriend, girlfriend. And there's always conflict, tension. That's a part of life, right? In Porter Gray's article we looked at, it talked about avoiding conflict. But some conflict shouldn't be avoided. We should hit that conflict head on and understand those conflicts. It's not all conflicts negative. There's some positive things that can come from conflict. Some of my experiences in the military, it's very rigid. What happens, what is written, it will be that way. I'm part of air crew, I'm a flight nurse. So we have a checklist. So if things go wrong, you follow the checklist verbatim. You won't be at fault because you resort to the checklist. So we constantly, once we follow our checklist, there's even a process for debriefing post-mission. And there's a checklist. It tells you when to debrief, what to debrief, how to debrief. Some of the other things that we looked at during this week 5 and 6, I talked about the readings, very interesting. Talked about managing conflict, implementations, toxic behaviors. Sometimes when trying to implement a project, especially one where it may not be a popular project, it may be controversy within that project. You may get some pushback. In my organization, we're a stroke center, recognized stroke center, and my goal is to make my hospital as a resource for smaller rural facilities where they can contact and get advice, even have telemedicine department. We have a robot at our hospital, but implement that in the other hospitals. I try to grow that learning, that best practice, I guess. There's much smaller hospitals. There's Parkview, there's Corona, tiny hospitals that don't have the same facility access to health for stroke victims. I mean, there can never be a neurologist in the hospital 24 hours a day, and even less so in a rural hospital. And that ER provider may not be comfortable managing those patients because that ER provider may not, who's to say it's been, may have saw one stroke patient in the last 3 or 4 months, so it may not be up to date. So it's important to have a content expert, if you will, or a neurologist that understands stroke. Some of the things we looked at in week 6, sorry, air's a little dry here today. Some things we looked at in week 6, identifying the right stuff, also managers and mediators. I'm not a nurse manager, actually I'm a nurse practitioner in my current role, but we're often called on to do, to manage things, manage patients, sometimes conflict within the other nurses. In my role, I'm a cardiothoracic nurse practitioner. So there's a CT surgeon that I work with, a few of them, multiple different personalities with each one of them. Some of them are very crass. They were trained in the East Coast, so their philosophy is death, you learn by death, right? You learn by being pushed, being afraid, right? I don't agree with that concept, but some of the providers I work with do. So he berates other nurses. So of course, when he comes to do rounds, it's very difficult for the nurses sometimes to focus. So my job is to manage that conflict. I try to prepare the nurse prior to us doing rounds. Hey, we need to have labs. I need to know how this patient actually doing. I need to know output. And, I-nos. I need to know daily weight, stuff like that. So as managers, we need to be mediators, meaning we need to somehow de-escalate conflict. For projects, like my clinical scholarly project, we need to get stakeholder buy-in, what I mentioned before. I think in Howell's article, he talked about being champion of innovation. We need to come up with a way to show that we're being innovative this whole process. My project, like I mentioned multiple times, is changing the way smaller hospitals have managed these stroke patients. Instead of using traditional medicine or what they might have remembered in a medical school, in a class years before, having them use the most updated technology, having the resource of a neurologist who may not be in-house but available to consult, having that in place. Also, some of the readings, chapters 4 and 12, look at transformational coaching. And also, again, my throat is dry. I apologize about that. Just looking at taking my clinical project and implementing, getting a plan for innovation. So making a plan for change, or putting my plan in place. All right. Well, again, thank you. I've taken enough of your time. We're down the home stretch. 2 more weeks to go. All right. See you next time. Goodbye. Hi, this is Tion Woods again. This is part 4. See the smile on my face? Finally, we got into week 8. Star Wars start in a few days. What I learned this last 2 weeks, very important. The reading was very interesting. We read Xander's book, The Art of Possibility. Giving Yourself an A was a very interesting. It blew my mind, the chapter. Talked about allowing yourself to give others A's. I really enjoyed that book. It talked about different ways of thinking. Talked about the connecting the 9 dots. That was very important. I really enjoyed that part. The lines, thinking outside the box. Too often we allows others to put ourselves in the box, other people. Being a leader, we shouldn't do that. We need to lead by thinking outside the box. I'm outside the box thinker. I like to think I don't tend to follow the crowd. I do things a little bit different. And that leads me to my next point. With my project, trying to get buy-in, trying to get one of our projects during week 7 was looking at shared vision and addressing fear of change. So as a leader, the way I would address shared vision, I talked about find out what's important to people. It's very important. In my situation, we're a stroke center, so I know that's important to maintain that certification and to grow as a stroke center. Stroke is very personal to me. So if you get employee buy-in, which is very important, employees, they do better when they feel like they're part of a team. Isaac, in one of his books, he talked about inspiring a climate of quality. The way to do that, you have to find a way to connect to your employees. Your employees may like, Google has a very nice way of doing it. They have game time on Fridays. I've been told this, I don't know how factual this is, that they have free thinking time where they can actually think about other things. They don't necessarily have to do their work on Fridays, not sit down and be rigidly attached to a desk. Duke has a great way of medical school. Duke actually, for the 3rd year, is a research year, was they're actually not in classes. They're not running around doing the same rigmarole as other places. So getting employee buy-in is very important. Find out what's important to them. For my clinical project, I know that stroke is very important to my facility, being a stroke center, managing those change. Fear of change is it's almost a debilitating thing to some people. The way I adjust change, you find out, you first address the rumor mills. You need to let whomever know, whatever you plan to change, what your intentions really are. My project, I'm seeking to create a way to reach out to the rural health settings and help them better manage patients, especially African American males over the age of 65. Dwelling my study down to that, my clinical scholarly project. So that's what I seek to do. In the military, the way we address change, we have there's an open door policy, but of course, like any organization, there's a chain of command. So you don't immediately go from the bottom to the general. You up channel things to your next chain, whether it's the staff sergeant, master sergeant, chief in the Air Force, or lieutenant, captain, colonel, and so on. But you're up channel things. But there's an open door policy. You can always come in and say, hey, is this really true? Should I be concerned? Organizations that are like that, I've read from my research, there's a lot more trust with those. One of the earlier papers we read, I think in the first 2 weeks, we talked about the vulnerability of a leader, being vulnerable and being able to empathize. I think that's very important. And we also looked at finding out members that need to be involved with our project. We talked about the 6 cycles of vulnerability. These cycles include being vulnerable, taking risks. You must take risks. Stretching the organization capacity, living a new reality, whatever that change is, evaluating the results, and cherishing the new knowledge gains. So some of the concerns with my project, I talked about, fear of risk taking, fear of failure, and fear of the unknown. This is new to me, like many members in our class. This is my first DNP. I don't know about any other members. My first undertaking of a doctoral program. So of course, in our area, there's been exponential growth within medical technology. So am I behind? Has there been a study? So I just got to do the research and find out, is there a study like this already been done? Can this study be replicated? Am I adding knowledge? We looked at also about the DNP essentials. It's important to advance the nursing practice, right? Having this scientific underpinning or advancing scientific knowledge. So that's very important. Also, we must look at integrating the advancing innovation, integrating the mission and the visions and the values within the innovation paradigm, assessing community and team needs, evaluating organizational structure, supporting organizational process, and measuring the results. Those ways to integrate a strategy and make sure they're successful. In week 8, our final week, we looked at change, drawing on our experiences and managing change. Some of the things that we also looked at, the mystery of that everything we need to know will present itself, right? Some of the things that I have a surgeon, he always say, if you wait long enough, the infection will present itself, right? The infection will have to declare itself. Same thing with change. We also got one of the readings in our book was looking at the renewing the spirit of leadership. It's very important to do that. Looking at chaos, the compensation of ignorance, very important. One of the points they talked about, the ponder, was about truth. Truth is a journey, not an event. Honor those who are seeking truth and avoid those who have found it. In this DNP process, one of the things I've learned, I know I'm a little long-winded tonight, the more I read, the more I learn, the more I realize I don't know. I think Albert Einstein said that. The more I learn, the less I realize I know. So that's very important. But so far, this process has been, it's really good for me. I'm really enjoying myself. I'm learning a lot. It's a lot I did not know about leadership. 8 weeks ago, I thought leadership was leading a bunch of guys to, to do what needs to be done. It's actually a lot more than that. And it's not a simple process of thinking you can lead. You have to be, like I mentioned in the past, you have to be a follower to be a leader. You have to be empathetic. You have to be vulnerable. You cannot present this superhero mentality and think that's going to suffice. It's not. So again, thank you, Dr. Betzel, for this time. I enjoy this. This concludes part 4. I learned a lot, and I really appreciate it. A few more days, I'm going to go see Star Wars. Have a good day.